Hi everyone, today I'm going to tell you about dry skin with acne. Acne does not always occur in oily skin. A lot of people do have dry or combination skin with acne, and this can be particularly troublesome to treat because most of the anti-acne medicines tend to dry and irritate the skin out. So in this video I'm going to tell you how you can tackle your acne when you have dry skin. So what are the things that you should remember? Concentrate on skin barrier repair. So there are two ways to tackle dry or combination skin with acne. First is using agents which are gentle on the skin, though the results may take time to occur, but they are not going to irritate your skin further. Okay, so that's why using gentle ingredients that help in repairing skin barrier is very important. I have a detailed video on skin barrier repair. Please do watch it, you will find it helpful. Second is going for oral medications. In oily acne prone skin, I like to use oral medications only in moderate to severe acne. But if you have dry skin or combination skin, then I like to use oral medications even if you have mild acne. So your dermatologist will be able to guide on what kind of antibiotics and oral medications will be helpful in reducing your acne. Because you are not able to tolerate too many topical products, introducing oral medications will help in controlling acne better. Once the acne is controlled in about 2 to 3 months time, then you can continue with topical creams in order to keep the acne under control. So what are the skincare principles that you need to follow when you have dry skin with acne? So first is you always use a gentle cleanser. Okay, we know that in acne prone skin we tend to use cleansers with salicylic acid or glycolic acid, but you want to go for a gentle cleanser when you have dry skin. Then you want to use some soothing hydrating serums which have anti-inflammatory properties which will help in reducing acne. Then use a moisturizer. Moisturizer is very important when you have dry or combination skin with acne, because this helps in reducing the redness due to acne and also helps in repairing skin barrier. You want to avoid physical scrubs completely. Instead, use gentle exfoliants and use a moisturizer immediately afterwards. So what are the cleansers that I prefer in patients with dry or combination skin with acne? I like to use either the Cetaphil Gentle Cleanser, Episoft Cleanser, Cerulean Cleanser for sensitive skin, Squalane Cleanser by The Ordinary. All these are very gentle on the skin and effectively cleanse your skin without drying it out, which is what we want. You can even use cleansers with polyhydroxy acid or mandelic acid, the names of which I'll be mentioning in the description box below. Now we move on to the next step, which is the serum. So when you choose the serum, you have to be careful that the ingredient is not irritating on the skin. So some of the ingredients that I prefer are niacinamide. Niacinamide is one ingredient which I look at as jack of all but master of none, but it is particularly helpful in reducing acne in dry and sensitive skin and even in combination skin. So what niacinamide does is it helps in repairing skin barrier and also reduces oil synthesis from the skin, and it also helps in reducing redness due to acne. So niacinamide is a good ingredient to include in your skincare routine. You can use this twice in a day. Few of my recommendations for niacinamide are the Dermaco 5% niacinamide, The Ordinary Niacinamide Serum, Be Body Wise Niacinamide, and Tevenka Cream. Second ingredient you want to look for is Centella Asiatica. Centella Asiatica is a very soothing ingredient. It has anti-inflammatory properties, antioxidant properties as well, and it helps in reducing acne and acne-related redness. So Centella Asiatica is very well tolerated. Along with that, other ingredients you can look for is pantothenol. Pantothenol is a vitamin B5. It is very gentle and moisturizing on the skin, and it also helps in repairing skin barrier. You can also look for ingredients such as green tea extract. Green tea is also known to have anti-inflammatory properties, so helps in reducing acne and redness associated with acne. Few of my recommendations with these ingredients are Dr. Sheth's Centella Niacinamide Serum, Sugandha Centella Green Tea Gel, Refresh Skin Science Hyaluronic Acid D-Pantothenol Serum, Dr. Sheth's Aloe Pantothenol Hydrating Gel, One Thing Camellia Sinensis Leaf Extract, Innisfree Green Tea Seed Serum, Plum Green Tea, and Zinc Complex. Another ingredient that can be well tolerated is azelaic acid, but you need to be a little careful with azelaic acid because it can cause a little bit of stinging and burning. Everybody will not be able to tolerate azelaic acid. So azelaic acid is a really good ingredient to include. It helps not only in reducing acne but also in dark spots that is left behind by acne, and also the red spots tend to lighten with the use of azelaic acid. Few of my recommendations for azelaic acid cream are Aziderm Cream and Izanic Gel. Use azelaic acid twice in a day. If you have very irritated skin, you can first use a layer of moisturizer and then use azelaic acid on top and then use a moisturizer again. You can also consider treating your acne by spot treatment. We don't usually recommend spot treating your acne because you might treat one area and the acne will develop in some other area, and acne can develop anywhere on the face, so that's why we like to treat the entire face. But in cases when you have very dry skin, irritated skin or combination skin, you can consider applying the active agent only in the area of acne. This is particularly helpful if you are somebody who gets acne eruptions occasionally and you have overall clear skin but you get acne eruptions once or twice, or you are somebody who gets acne eruptions only in a certain particular area, like let's say the forehead or the chin. That's the only area that you always get acne. So in such conditions, you can consider spot treating the acne. Spot treatment is done with either salicylic acid or benzoyl peroxide. Go for a lower concentration of salicylic acid. Don't go for above 1%, and benzoyl peroxide 2.5%. Benzoyl peroxide can be used as a short contact treatment. You can apply the benzoyl peroxide and wash it off after 15 to 20 minutes. Salicylic acid, use a very small quantity only on the spot, and you can leave it on overnight. Now we move on to moisturizers. Moisturizers, very important in treating dry skin with acne, because even these ingredients that I've mentioned will not cause irritation to the skin. But let's say if you want to use an azelaic acid or a spot treatment with salicylic acid or benzoyl peroxide, then using a good moisturizer is very, very important. Otherwise, it's going to irritate your skin. So you want your moisturizer to be moisturizing but not too thick and heavy on the skin. So look for ingredients such as hyaluronic acid, glycerine, zinc PCA, which can moisturize your skin without feeling too heavy on the skin and without clogging your pores. Few of my recommendations are Excella Moisturizer, Acrophy, Oriza, Acne OC Cream, the Formula RX Malaysia Cream, Dot & Key Skin Barrier Ceramide Cream, and Emollient Cream. These moisturizers help in moisturizing the skin without feeling too heavy on the skin. So that is what you want when you are dealing with acne. Remember that moisturizer is very, very important. A lot of people feel that whenever they use a moisturizer, then they tend to break out. So they try to keep their skin dry. But this will actually worsen your acne, make your redness worse, can worsen your dark spots, and also can continue to give you acne eruptions. Okay, so applying a good moisturizer is very, very important if you want to control your acne. So follow a very simple skincare routine, a gentle cleanser followed by a serum and a moisturizer. This should be helpful in controlling your acne even if you have dry skin. For sunscreen recommendations, I have a separate video on sunscreens for oily skin type. I have also mentioned sunscreens for people who have acne prone skin, so you can choose one from that. I'll be linking that video in the iCard above. You can click on it to watch. I hope you found this video useful. If you like such skin and hair related content, you can follow me on my Instagram handle Dr. Aanchal MD, where I post skin and hair related content daily. Thank you for watching.